Hi, I'm Dr. Steve Pinney, and today we are going to review high ankle sprains, an injury that's not nearly as common as a classic ankle sprain, but is often much more serious. A classic ankle sprain occurs when the foot is rolled or inverted, leading to partial or even complete tearing of one or more ligaments on the outside of the ankle. An ankle sprain creates pain and swelling and may limit the use of the ankle joint during the recovery period. However, it does not affect the stability of the ankle mortise. The ankle mortise is the top part of the ankle joint that is formed at the end of the two bones of the lower leg, the tibia and the fibula. These bones are held together by strong ligaments that stabilize the ankle joint. The ligaments binding the tibia and the fibula together collectively make up what is known as the syndesmosis. A high ankle sprain is an injury to one or more of the ligaments that make up the syndesmosis. It is an injury that can lead to considerable ongoing pain and may even lead to instability or looseness of the ankle mortise. The mechanism that causes a high ankle sprain is typically quite different from that which produces a classic ankle sprain. The foot is usually planted on the ground with the lower leg rotating around the ankle. This creates tremendous stress on the syndesmotic ligaments stabilizing the front part of the ankle joint. These ligaments are then torn, either partially or completely. This causes immediate pain, swelling, and often an inability to weight bear. The primary ligament injured in a high ankle sprain is known as the anterior inferior tibiofibular ligament. Diagnosing high ankle sprain can be a bit tricky. Often the mechanism causing the injury will give some suggestion that a high ankle sprain has occurred. Also, the location of pain is in a different area than that seen in a classic ankle sprain. While there may be pain on the outside of the ankle, similar to what is seen with a classic ankle sprain, usually most of the pain associated with a high ankle sprain is in the front outside part of the ankle joint, right where the anterior part of the syndesmosis starts. The use of imaging studies can be very important in determining whether a high ankle sprain has occurred and, if it has, determining the severity of the injury. Plain weight-bearing x-rays of the ankle joint should be normal, although if the high ankle sprain is severe and the ankle syndesmosis has been disrupted, a widening of the syndesmosis may be identified. An MRI of the ankle should identify any associated ligament injury. There will usually be disruption of the anterior inferior tibiofibular ligament at the front of the syndesmosis. Determining the extent of damage to the ligaments holding the tibia and the fibula together can be aided by an MRI. However, stressing the ankle with weight-bearing x-rays or rotational force applied to the foot may be needed to determine whether there is gross instability and widening of the syndesmosis. The extent of injury to the ligaments holding the tibia and the fibula together will usually determine the prognosis and treatment following a high ankle sprain. There is a spectrum of injury patterns to these ligaments which range from partial tearing of the anterior inferior tibiofibular ligament to complete disruption of all of the syndesmotic ligaments, leading to gross instability of the syndesmosis of the ankle joint. Most high ankle sprains are stable with partial tearing of the anterior inferior tibiofibular ligament, but continued stability of the syndesmosis overall. If this is the case, treatment is usually conservative. Relative immobilization in a cast or boot for 6 weeks or more may be required before weight bearing can be started. Although early range of motion and soft tissue mobilization can be started after the initial swelling and discomfort has settled. Once weight bearing has started, a gradual increase in activity level is undertaken. A balance is required between increasing strength, range of motion, and activity level, while still protecting the ligaments so they may continue healing and getting stronger. A return to activity can be expected at some point between 2 and 5 months post-injury. The actual recovery time will depend upon the severity of the initial high ankle sprain and the sport or activity that is being performed. Patients will often continue to improve for 12 months or more after a high ankle sprain. If residual symptoms persist in spite of this type of recovery program, further treatment, including possible surgery, may be required to address residual scar tissue or damage to the ankle joint that may have occurred at the time of the injury. More severe high ankle sprains that render the syndesmosis unstable will usually require surgery. In some patients, it's not immediately clear whether there is gapping at the syndesmosis, and in these patients, early surgery to assess the syndesmotic stability may be performed. The surgery typically involves looking inside the ankle with an arthroscope, assessing the damage to the ligament, and determining if there is any obvious widening of the syndesmosis between the tibia and the fibula. If there is instability of the syndesmosis, the ligaments may be repaired and the syndesmosis stabilized with screws or a strong suture holding the two bones in place. The ankle then needs to be relatively immobilized until there is adequate healing of the ligaments at the level of the syndesmosis. This may take 6 to 10 weeks, and after the ligaments of the syndesmosis have adequately healed, a graduated rehab program is instituted to regain motion, strength, and function. For more information on high ankle sprains, click on the link below. Wishing you good foot health, I'm Dr. Steve Pinney.